I'm Rick Buck, and I've been a dentist for 17 years. This patient came in the other day because she didn't like the look of the white spots on her front teeth. So in this appointment, I'm going to remove the white spots and replace them with cosmetic white resin composites. Meanwhile, I will explain why I'm doing it this way and not other methods, and the pros and cons of doing it this way. So as I'm numbing the patient, you can see some of the spots I will be removing. 2 spots on the right central incisor, one kind of on the edge of the tooth, and one towards the middle and on the side. Then the upper right lateral incisor has a white band across it. The left lateral incisor has a white spot they want removed as well, midway down the tooth toward the central incisor. I start by removing each of these spots by simply drilling them away. Now, as I drill these spots, I make sure that I drill deep enough so that either the spot goes away completely or the filling that I eventually will put in there will be thick enough to conceal any underlying discoloration. What is more important is that I drill wide enough to remove the whole white spot. If you're not careful, sometimes there will be an edge of the white spot that isn't fully drilled away that is hard to see. Then, when you put the composite in, you can see that you missed that line, and then if that happens, you need to start over and go back and remove it and drill it away again. This method of drilling it away is highly effective as it removes the underlying demineralized enamel, which is responsible for the discoloration, and it replaces it with a durable, aesthetically pleasing white filling. Not only do I make it so the white filling matches the natural color, but also it will strengthen the structure, providing both cosmetic and functional benefit. Other methods such as remineralization treatments, whitening, or microabrasion often fall short of these goals. Remineralization may not fully restore the tooth's appearance. Whitening can exacerbate the contrast between the white spots and the surrounding enamel. And microabrasion may not sufficiently remove the deeper spots. Thus, you can see drilling and then filling ensure a comprehensive and lasting solution for eliminating white spots. These other methods in general are not 100% effective, and I like methods that work 100% of the time. Because I'm charging the patient for this, before we fill the tooth, I like to select a shade of resin composite for the tooth. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. I do this by simply expressing some of the white filling that we're going to use onto the tooth and seeing how close it matches. And then I just pick the shade of composite that most closely matches the tooth. The composite will match even better after I set them into place. But once I pick the shade, I remove the trial composite. Now, with all the spots removed, we need to fill the tooth and start by etching the surface of the slot that we made. Etching teeth is a crucial step in the dental filling process. It involves applying a mild acidic solution to the tooth surface. This process roughens the enamel, creating microscopic pores and increasing the surface area for better adhesion. By etching the teeth, the bond between the tooth and the filling material is significantly strengthened, ensuring a more durable and long-lasting restoration. This enhanced bond helps prevent the filling from dislodging and reduces the risk of further decay around the edges and further staining around the edges. So next, we bond the tooth by scrubbing it into place and then blowing off the excess and using a light to cure or set the bond into place. This adhesive bond creates a strong connection between the tooth and the filling material, ensuring the filling stays securely in place. The bond helps distribute chewing forces evenly across the restored tooth, enhancing its durability and functionality. Additionally, a good bond minimizes the gaps between the filling and the tooth, reducing the risk of bacterial infiltration and subsequent decay. Now, we add the composite in layers and we shape it all into place with my instruments, or sometimes I even shape it with my gloved finger. After I have shaped them into the exact spot where I want them, I set these into place with a curing light as well. I like to slightly overfill the slots in the tooth that I've made. That way I can shape them exactly how I want them to be. And to do that, I just use these little sanding discs that I hook up to my handpiece. Anything that looks off in this step will be adjusted away in just a few moments. Now, we smooth and adjust all the fillings, and there are two important parts to this. First, we are shaping the fillings, which is pretty easy in this case, but second, we are trying to get a smooth transition from natural tooth to filling. If you don't do this, the filling will look amazing when the patient leaves, but in a few weeks or months, these will start to gather stains or decay around the edges. The edges can also chip more easily, which once again will gather more staining. So it's really important to get this transition as smooth as possible without any overhanging resin composite. And once we are done smoothing these, we then polish them with more fine sanding discs like the ones we just used. Let's just take a look at the final results, as well as the before and afters. The patient is very happy with the results. The major white spots are gone, and this looks cosmetic and natural. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.